Health. We welcome Dr. Shana Egloff-Kupets. Welcome to the show.
Yeah, thank you so much for having me.
Yeah, nice to see you. Did I say your name right this time?
Absolutely, perfect. I appreciate
Awesome.
it.
And you're in family practice at Henry Ford. What location?
So I'm at the East Michigan site, which is located near the East Michigan Myers.
That's pretty big and busy practice, isn't it?
We are very busy, yes.
How many practitioners are on site?
So there are 6 of us, 3 physicians and 3 APPs, 2 PAs and 1 nurse practitioner.
Nice. How long have you been in family practice?
I've been at this site actually for 11 plus years, coming up
Okay.
on 12 in January.
Oh, wow.
Yep.
Happy anniversary.
Yeah.
Why did you decide to pick family practice for your specialty?
I would say there's a couple main reasons. I love the relationships that I have with my patients. They're very special. But also it's a variety, right? You never know what you're going to see. You might see a lot of the same things coming through, but then you'll get something, whoa, I haven't seen this for a long time, or, there's just so much variety. So it keeps it sort of interesting as well.
And we were talking before the show. Shana grew up in Rhode Island, and I grew up in Vermont, but they're both in New England, but they're not that close.
No, no. Well, Rhode Island's a very small state. So.
It is. Yeah, so how did you get out of Rhode Island and then end up in Michigan?
Yeah, sort of variable. So I ended up doing my undergrad in Ohio and then did a couple years of research in Washington, D.C., did med school in Pennsylvania, went to my residency in Colorado, and then we ended up moving to Michigan in part because my husband wanted to go back to school. This was a great location for him, and now we're here.
Awesome.
Yeah.
So go to college, see the world.
Exactly.
Nice. Well, this weather is just unbelievable. We're all enjoying it,
Yes.
obviously. But it's every good thing, comes to an end,
Sure.
including this weather.
Yeah.
So flu. It's
Yes.
typically we're seeing flu this, late October,
Yes.
aren't we?
Yeah, so this is sort of the beginning of flu season. October is typically the start of flu season. And so, what we'll see is sort of a gradual increase in cases over the next few months, October, November, December. And then typically we'll see the cases peak somewhere in December, maybe January or February. If we look back at last year's flu season, the 2023 to 2024 season, there were actually 2 peaks. So it peaked both in December and then again in January before starting to, cases to sort of start to taper off. Flu season goes on though, January, February, March, until it really starts to end the end of April.
I think COVID has made all of us more aware of, how viruses spread, and we get it. You talk about the peaks, holidays, being inside, school.
Yeah.
Is flu pretty much spread like COVID was? It's just, being close to people, respiratory?
Yeah. So influenza virus is spread by a droplet transmission. So if you have someone who is infected with the virus and they cough, they sneeze, they talk, and they're near someone, that person can be infected with the virus. Now, it's also possible that transmission can happen by touching surfaces that are infected with the virus, and then touching our eyes, our nose, our mouth. But that form of transmission is less likely than the droplet form of transmission.
Yeah, so we were all washing our groceries in the early months
Sure.
of COVID.
Right.
But that was based on truth.
Absolutely.
Same with flu. It could. You touch a doorknob. It
Correct.
Could, yeah.
Right.
All right, so flu, COVID, RSV, a cold. There's so many. To me, it seems like there's a lot of similarities. Are there specific symptoms of the flu and of this year's version of the flu?
Well, I will say in my office specifically, we have not yet, as of Friday, had any positive cases come through the office. That's
flu.
not a flu.
Wow.
So I can't really tell you yet what we're seeing sort of for this year's flu, but what I can tell you is sort of typical symptoms of flu. So influenza will typically come on very abruptly, right? So patients will start to experience fever, chills, body aches, muscle aches. Sometimes people are experiencing a sore throat, cough, congestion, headache, fatigue. That's kind of the list that's typical.
And it happens just like that.
A lot of times it really does. It's different than maybe the common cold where you start to get some symptoms slowly. The flu is more abrupt.
Now, is there tests that would, positively tell someone that it is the flu?
Sure, yeah. We have office-based testing that we can send out, and that can confirm the flu virus.
Oh, really? And people get the flu, it sounds like, a few days of toughing it out and you get better. But it can be dangerous. What's the population that you're concerned with if they get the flu?
Yeah, so there are definitely certain groups that are considered higher risk for complications from flu. So if we talk about age, for example, our patients that are ages 65 and older are going to be at increased risk, right? Their immune systems just aren't as robust. Now, if we look at the opposite end of the age spectrum, our children, right, age 5 and under, especially under age 2, they're also going to be at increased risk. Their immune systems are still developing. There's a couple other groups that are also going to be at higher risk. So our patients that have certain chronic health conditions, for example, lung diseases, asthma, COPD, heart disease, patients with diabetes, so these people with chronic conditions are going to be at higher risk. And then, of course, our pregnant women are at higher risk as well. So while we, definitely want everyone to get their vaccine, these groups that are at higher risk for complications, we really want to target them as well.
And all those people, they're eligible for a flu shot?
Correct.
There's no, just tiny babies?
Correct. Under age 6 months, we don't have a vaccine. So people who are caring for young children or infants definitely want to be vaccinated.
Awesome. And it's once a year,
Correct.
Right?
Correct.
So
Yeah.
the formula, it changes.
Yeah, so that's a good question. The flu is a virus that changes quickly. So the flu that we're seeing circulate or will see circulate for this flu season is different than the flu that we saw circulate for the 2023-2024 season. So even if someone says, hey, I had a flu shot January, February 2024, you had a flu shot for last season's flu. So we're still recommending a flu vaccine for this season's circulating influenza virus.
Time-wise, how soon after you get a flu shot do you feel like, you have the protection?
Usually about 2 weeks after, we feel like we're pretty fully protected.
And then how soon after someone coughs in your face that has the flu would you possibly get sick?
Yeah, so typically it's going to be on average maybe around 2 days, but anywhere ranging from 1 to 4 days.
Just like that?
Yeah, yeah.
Wow.
Yep.
I got a flu shot.
Great.
I got a COVID shot.
Great.
In my flu shot, I was looking at my chart and it said something like extra strength.
Right, right.
Because I'm older.
Well, it sounds like you got the right shot. So I think you're asking about the flu shot for patients who are above age 65 and above. And so, yes, there is what we call a high-dose flu vaccine for patients who are 65 years and above. And I had mentioned earlier, right, that patients who are 65 years and older, the immune system is not as robust as it once was, right? So with the high-dose flu shot, it has about 4 times the amount of antigens that's in the standard flu shot. So this gives our patients with a weakened or, just a less robust immune system a chance to mount a better response to the vaccine.
Yeah, I appreciate that I was eligible for that, but it's like, you see a bottle of Tylenol and extra strength Tylenol. If you have a headache, why would you buy weak Tylenol? Why wouldn't you go, full out? And same with the flu shot. Why wouldn't we give the high power to everybody?
Right. So, what we found is that, for maybe the rest of the population, age 5, 64 up to 64, right? We don't need that extra, 4 times the strength flu shot because our immune systems are functioning at the appropriate level, right?
Overkill.
It would be overkill,
Yeah.
right? And maybe we'd have more in the way of side effects.
Oh, good point. Yeah, I felt that I didn't feel great the day after my flu shot.
Sometimes side effects, sore arm or a little bit of discomfort over the
Yeah.
12 to 24 hours.
But much better than being sick with the flu.
Absolutely.
Yeah. So if we do get the flu, let's see, chicken soup, fluids.
Right. So, chicken soup, I guess, is sort of one of those, hey, everyone, let's have our chicken soup. We're not feeling good. But the reality is, sure, does it give you some hydration? Yes. Right. So if we get sick, we want to use some of these common sense measures, right? Making sure that we're getting good rest, making sure that we're getting good hydration, making sure we're getting good sleep. I will say, there are certain people, if they get infected with influenza, those high-risk people, they may want to talk to their primary care provider because there are some antiviral medications out there, and they may be a candidate for those that might help decrease the severity of the flu symptoms.
Plus, it could be COVID. It could be something else.
Absolutely, right.
So get tested.
Get tested,
Come in and find out.
right.
Awesome. Well, we appreciate the great care you provide our community, and we appreciate you coming in today.
Yeah, thank you so much. Thanks for having me. I appreciate the time to talk about this important vaccine.
Yeah, let's keep everyone healthy this fall and winter. From Henry Ford Jackson, family practitioner, Dr. Shana Egaloff-Kupitz.